Office of Emergency Management, the Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. A preliminary report now shows that a storm with an EF3 winds struck our neighbors in Chattanooga on Sunday evening, a very similar storm to the one that struck Nashville, claiming 2 lives in Hamilton County and displacing over 100 individuals and families. Now, Nashville knows all too well what our friends in Chattanooga are going through. Scenes from storm-damaged areas are reminiscent of our own devastated neighborhoods just over a month ago. Now, in the aftermath of the March 3rd tornado here in Nashville, Chattanoogans were among our many friends who generously contributed to our recovery efforts. The Community Resource Center has already started receiving, sorting, and distributing needed items, including personal products, personal hygiene, baby products, and cleaning supplies to the Chattanooga area. I urge anyone who has the ability to contribute at this time to visit the community.
All right, we are having a bit of a technical difficulty right there, but right now he is talking about hearing from Mayor Cooper, talking about the preliminary report of the EF3 tornado that hit Chattanooga that we've been telling you about. This hit on Easter late at night, but similar to the one that struck, he said this one actually claimed 2 lives there in Hamilton County. So he was just talking about how we all know too well what those families are going through after the tornadoes that hit the mid-state. All right, we do have our signal back, so let's listen in. Our safer at home
order to the end of the month also. But we've been gathering and analyzing all available COVID-19 data to inform our decision-making, and I'll have more to say about this early next week. Our thoughts are with those who are sick and with the loved ones of those who have died from the complications related to COVID-19. I urge everyone in Davidson County to stay the course, to continue remaining at your home whenever possible, and only leave your home to run essential errands, and do wear face coverings when social distancing measures are difficult to maintain. Now, I'd like to welcome former U.S. Representative Patrick J. Kennedy, who is joining us remotely this morning to discuss the importance of mental health awareness during the time of the coronavirus and the local mental health resources available to all Nashvillians. Representative Kennedy is one of the nation's leading mental health advocates. He's founder of the Kennedy Forum and co-founder of the Psych Hub, an online learning platform dedicated to improving mental health literacy. I'd also like to welcome back Diane Lance, Director of the Office of Family Safety for Metro, and I want to stress that during this time of the Safer at Home order, not everyone is necessarily safer at home. In times of heightened stress, uncertainty, and financial strain, instances of domestic abuse, child abuse, and elder abuse can become more severe and even deadly. I'm grateful to the work of the Office of Family Safety and helping victims of interpersonal violence throughout Davidson County, and I want to remind everyone of the following resources. If you are experiencing domestic violence through assault, intimidation, or abusive behavior, call the Office of Family Safety at 615-880-1100. You can also contact the YWCA's Domestic Violence Crisis and Support Hotline at 800-334-4628 or text 615-983-5170 to get help without speaking a word. Both lines are anonymous, confidential, and available 24/7. And as always, you can visit covid19.nashville.gov to find a link to a list of local mental health providers offering both sliding scale fees and telehealth services at this time. If you are experiencing a mental health crisis, do not hesitate to call the Mental Health Cooperative's Crisis Hotline at 615-726-0123 or the National Suicide Prevention Lifeline at 800-273-8255. Remember, you do not have to face a mental health challenge alone. Help is only a text message or a phone call away. And with that, I'll turn it over to Dr. Alex Shahanger, Chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on the coronavirus in Davidson County. Yesterday, we had 3 additional coronavirus-connected deaths in Nashville. A 41-year-old gentleman, a 75-year-old gentleman, and an 82-year-old gentleman. All had underlying health conditions. My sincere sympathies go out to these gentlemen's family and friends. This brings the total number of fatalities in Davidson County to 16. We now have confirmed 1,457 cases here in Nashville, and that's an increase of 72 from yesterday. Furthermore, in our region, we have an additional 1,439 cases, which brings our total to nearly 2,900 in this Middle Tennessee area. Of the Davidson County cases, 1,134 are currently active cases. 307 residents have fully recovered from the virus and are back at home. This morning, I want to again show you some data about cases in Davidson County. This heat map, which we first showed you last week and have updated every week for your review, demonstrates a total number of COVID-19 cases that have been reported to the Metro Public Health Department through April 13th. The heat map is based on zip codes and does not reflect actual addresses or exact locations of the cases. This map represents the magnitude of the virus in our county. It shows where the persons who tested positive live and not necessarily where they contracted the virus. You will also see the virus is more prevalent in some areas, and these were traced back to several events of group gatherings. Another takeaway is that there are cases all over the city. This is consistent with our understanding of this virus, that it knows no boundaries or zip codes. Yesterday, the community assessment centers were open. 300 people were assessed and 264 individuals received tests yesterday. As always, there's no cost for people to be assessed nor to receive the test if indicated. The centers are open from 9 a.m. to 3 p.m. Monday, Wednesday, and Friday, and will be open tomorrow. If anyone you know is experiencing symptoms of fever, cough, shortness of breath, or new onset of loss of smell that's unexplained, please have them seek medical assistance or call our hotlines. Our hotlines are open 7 days a week at 615-862-7777, and they're open from 7 a.m. to 7 p.m. You'll speak with a medical professional who will answer your questions and determine if additional screening is needed, and if so, we'll direct you to where you could receive that screening. Finally, as the mayor noted, the governor extended the safer at home order for all Tennesseans until April 30th. And I also thank the governor for his leadership on this. You may wonder what this means for Nashville, and right now we are developing a plan, as the mayor noted, based on the best available data, which will inform the future decisions regarding this. We'll have more to share with this plan as it is finalized. What the data is showing us is that what we are doing as a community is making a difference. Staying at home and away from others has truly helped them flatten the curve. But remember, please continue to stay at home and go out if only necessary. Practice social distancing and get assessed if you have symptoms.
All right, you have just now been listening to some of the numbers, the very latest. We did hear the latest number of deaths.
Thank you very much,
Unfortunately,
Doctor.
3 additional deaths.
The Mayor, I appreciate the opportunity to be with you all today. This is obviously an unprecedented time in our nation's history, and it requires a response to this crisis that hasn't ever been foreseen, which is one of the reasons why we have too many of the tragedies that we're facing as a nation is because we were ill prepared. We didn't think it could happen, even though a lot of the scientists told us it was a very real possibility. Frankly, we know now that our biggest challenge was our own lack of preparation. It wasn't that as a nation we couldn't deal with this, it was that we didn't prepare to deal with this. And so COVID is an example of what happens when we're ill prepared. We don't have enough personal protective equipment. We don't have enough ventilators. We don't have the kind of response and strategy that we need. As someone who's someone in recovery from addiction and mental illness and who has tried to write better mental health and addiction policies for our country, I've been frustrated and stymied over decades at the lack of willingness in this country to address another public health crisis, and that's the crisis of suicide and overdose, and the crisis of disability in this country due to untreated and unaddressed mental health and addiction. Too many of our fellow Americans, just like in the case of COVID, die, and they die needlessly, and it's a really direct result of our lack of preparation, our lack of prevention, and lack of adequate support systems that would otherwise avert and mitigate these incredibly negative trends that we're seeing in our country and the mental health crisis that we're still facing. The tragedy of COVID is that it exacerbates this already prevalent mental health and addiction crisis. No one doubts that mental health and addiction is real. Every single American has been faced with a mental health issue in this COVID crisis, themselves, not just a family member, but themselves. You cannot help but face a mental health crisis when you see your job disappear, when you're furloughed, when your business shuts down, when you're separated from friends and family. All of these things and the uncertainty and anxiety and depression that result are a reminder that mental health is something that affects all of us. The question now is, are we going to prepare ourselves in a way that we never prepared ourselves during the COVID crisis? What is the equivalent of personal protective equipment? What's the equivalent of ventilators? Well, I'm proud that I partnered with a Nashville-based company, a hub, to prepare resources and a toolkit for public officials, as well as healthcare systems, as well as families, as well as providers. It is called Psych Hub, and what it is a hub of resources for those looking to prepare for the mental health and addiction crisis that lies right underneath this COVID crisis. And I salute Mayor Cooper and the task force in Nashville, and I really appreciate the fact that all of you are looking to take this toolkit to other municipalities and counties in Tennessee so they can benefit their constituents as well with the resource that can help us prepare to mitigate a crisis that we can prepare for if we start to work on it now. So with that, I thank you all for giving me the opportunity to speak. I'm honored that companies like HCA, proud Nashville citizen, corporate citizen, has partnered with Psych Hub, as well as many others, including all of our insurance carriers. This is a wake-up call for our whole healthcare system, and we need to be prepared to not only address COVID, but the impact of COVID on our mental health as a nation. And I hope that Psych Hub provides some of the tools that will allow us to do that. Thank you very much.
Thank you, Representative Kennedy. It's now my pleasure to introduce Diane Lance, Director of the Office of Family Safety.
Thank you, Chris. And that was really wonderful to hear from Congressman Kennedy about Psych Hub and the available resources for those really struggling at this time. My name is Diane Lance. I am the department head for Metro Government's Office of Family Safety. The Office of Family Safety works to help victims of domestic violence, sexual assault, trafficking, elder and child abuse. Today's circumstances, as Congressman Kennedy pointed out, are challenging. These challenges are particularly acute for people living with mental illness, addiction, and also people with a history of being abused by an intimate partner, a family member, a trafficker, or a caregiver. There are so many emotional triggers happening all at once right now. And any one, let alone all of these, can resurrect past traumas and really concerning feelings. These triggers are hard to avoid because many are amplified and compounded right now, such as isolation, financial insecurity, unemployment, unmanageable stress, feelings of powerlessness, a lack of certainty, and feelings of being trapped. Any one of these triggers is hard to handle, let alone having all of them happen at once and trying to handle it all on your own. The good news, though, is that accessing care has never been easier than it is right now. And I think that's worth repeating. Accessing care has never been easier. You've heard Congressman Kennedy talk about Psych Hub, right there online, a multitude of wonderful resources, including really helpful videos. Counselors and advocates across the city and the state now have the capability to help you at your home, from their home. It has never been easier to access care. And like the city, so many nonprofits remain open and hard at work to help others. Those experiencing domestic violence or other forms of interpersonal violence, I want you to know that all 3 shelters in Nashville-Davidson County are open. That includes Agape, the Mary Parrish Center, and the YWCA Weaver Domestic Violence Shelter. They are all open with strict COVID-19 precautions in place. There is no need to stay at home with an abuser. These shelters want you to know that they are committed to helping keep you and your children safe. Do not hesitate to call for help at any one of these shelters to talk about options and to talk about how to leave safely. 800-334-4628 is the YWCA hotline. And as Mayor Cooper pointed out, you can also text at 615-983-5170. Also open is Metro Government's Office of Family Safety and the city's Family Safety Center. Our advocates remain at work and are eager to help you. They can help you secure an order of protection, connect you to needed resources, plan for your safety, whether leaving or staying, and assess your level of risk. You can come to 610 Murfreesboro Pike for assistance. You can call 615-880-1100 and talk to an advocate and do all of those things. You can go to our website at ofs.nashville.gov and find ways to stay safe with an abuser in the home and evaluate your level of risk, which includes looking at things such as a history of being strangled, a firearm in the home, and threats of being killed. For those with a family member or a friend or a coworker that they know is living in an abusive situation or struggling with other concerning issues and living with an abuser, please stay connected to them. Make sure they know about the excellent resource of Psych Hub. Make sure they know that all the information you hear every day is at covid19.nashville.gov and that advocates are available to help at the Family Safety Center. And for those struggling with violence themselves, please call us so we can help. And please know that you are not alone.
Thank you, Diane. We will now start the Q&A portion of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Harriet Wallace at Fox 17. Go ahead, Harriet.
Yes, good morning, everyone. I have 2 questions for the mayor and one for Dr. Jahangir. My first questions for the mayor. First, like all of us, we've received multiple reports of people having trouble getting unemployment and waiting on the line. I know this is more of a state issue, but for those in Davidson County, naturally that will present an issue for Metro. Have you had conversations or is there a plan to talk with those on the state level to mitigate this issue or advocate on behalf of Davidson County residents? My second business question to Mayor Cooper. as we walk through the stay and safer at home orders and maybe beyond, have there been conversations about how businesses will be able to operate even at a minimal level? Because while the physical health is priority, financial health is also important. And then I'll follow up with my question for Dr. Jahanger afterwards.
Mayor Cooper.
Thank you, Harriet. I agree. All of us seem overwhelmed, including the state. So we'll be talking with the Unified Command today and emphasize the importance of putting extra resources into helping people who find themselves without work in this time of great difficulty. How do we reopen the community? I think it's going to be a subject for all of us in the weeks ahead. I think it's going to require personal protocols. It's going to require every level of government operating well together. I do have kind of a personal request for everybody in Nashville, which is to take your temperature. Help us find the cases, isolate the people with the cases, be part of the solution. And I think in the weeks ahead, you're going to be hearing a lot of messages like that about how we can all work together to not only flatten the curve, but get back to work sooner. And so if everybody in Nashville took their temperature every day, not only at your workplace, but at your homes, and begin to pay attention to that in order to flag who might be an asymptomatic carrier. You don't always have the coughs, et cetera, but I think the temperature is now viewed as the most reliable way. Dr. Jahanger will have a view on this, I'm sure, of beginning to identify where the problem is and self-isolate, call the hotline, be assessed, be tested, and then public health protocols can help you isolate. In the end, instead of all of us being isolated, let's just end up, the solution here will be isolating the people who have the virus. And that's going to be containing a smaller population within our larger population, and we're all going to have to work together to be able to do that. But thank you for your question.
Harriet, you said you had a follow-up question for Dr. Jahanger?
Yes, thank you so much. I'm also getting notifications from people saying that they're calling in, expressing some symptoms of the virus, but are being told if they do not need hospitalization, simply to stay at home and just self-quarantine. How are those folks being factored into the data that you all are collecting daily? Are they considered in the positive cases or considered at all as we look at policies and strategies to flatten the curve?
Thank you, Harriet. I'll tell you, if anyone who calls our hotline, so I don't know where these individuals you're referring to are calling, but if you call our hotline and you represent any of those 4 symptoms I described earlier, cough, shortness of breath, fever, and now new onset of smell loss that is unexplained, you will be referred to a medical professional for assessment. I know this very closely because I've read the scripts, or I read the scripts over the weekend when we redid them. So I just want to clarify, I don't know who your source necessarily is calling, but if they call our hotline, that's the message they should be receiving, and if they don't, then please let me know. But I know our personnel, and I'm sure they are. And to answer your second part of your question is no, unless you test positive, you will not. That people are not put into the data. I mean, you have to have consistency in how data is collected. If it's a positive test that's reported to our Department of Health. That's the only way that we determine somebody is positive in our community. Thank you.
Julia Palazzo, News 2. Julia. Julia, we can't, we're having a hard time hearing you, so we'll move on to Brett Kellerman at the Tennessean. Brett. Let's try Tosin Fakile.
Hi, good morning. Thanks for taking our questions. My first question is to the mayor. The governor talked about, hopefully getting things kicked off by May. I was wondering, do you think the city will be ready to open any of the businesses, any kind of businesses, sometime at the beginning of May? And if so, which ones? And if not, why? And my second question, probably Doctor could answer that. Now that it seems that there's progress in Nashville and across the state, are there still any plans for these extra beds to be set up at the Music Center and across the state?
Thank you, Tosin. With enthusiasm, I think we're all anticipating trying to get the city and the state reopened. I think this is the week for assessing the challenges behind how to do that. That's going to require a robust testing apparatus that both can test and have results in a short period of time. It's going to require the right amount of PPE. It's going to require caseloads flattening, and it's going to require excellent social investigations behind the disease, behind who has it, who they've been in contact with, so that we can get to those people quickly enough to build isolation around people who may be carriers. It's going to require a lot of internal social protocols for all of the businesses. How do we operate? Are we behind shields? Do we have masks? Are we wearing gloves? There are a lot of common sense things that we can do that can also flatten the curve. I think all these things happening together with a reduction in the increase in cases will allow the city and the state to get back to work. And it'll probably be in a phased approach over time as we very carefully monitor what's going on. But it's started with a concern about our testing capability, and the next phase for sure will require a robust testing capability, something that I know we in the state are working on pretty hard right now. But yes, let's get back to work in May. We hope that that is a possibility. We're only going to be able to get there, though, if we do social distancing very well right now. Thanks.
And to follow up your question regarding the Music City Center, as the mayor was saying, doing the things we need to do now has flattened the curve. We're in discussions daily with the Unified Command, including as early as this morning. I've already spoken with a member of Unified Command. We are looking for the overflow. Hospitals are doing okay right now, but we are still looking at that. Whether that includes the Music City Center or not is still in discussion, because we, thank goodness, because of everyone's vigilance, have not necessarily, we may not need the extra 1,600 or whatever number of beds that may need for hospital overflow. With that being said, we're very carefully working towards plans to make sure we have our systems covered if needed. So more to come.
Let's go back to Julia Palazzo on News 2. Julia. No. What about Brett Kelman, Tennessean? Alex Apple? Alex, can you hear us?
Yes. I have a question for the mayor. I'm curious, he spoke in the state of Metro about the hard financial times that are ahead. I'm curious, now that the governor wants to open the state back up in May, and you just spoke about the possibility being there, will how much the city is able to reopen back up be a factor in how much you feel like you can ask Nashvillians to pay more in revenue, or how much you feel like you can raise property taxes? I know you're still working through creating a budget, but I'm curious if that enters into the calculus.
Mayor Cooper?
Oh, completely. The reopening scenario and when Nashville can go back to normal has got a huge effect on city revenue. I want to note it's something that every other city is feeling also. I think there's an article in paper today going over the number of police forces in local communities that are being cut right now. We are not going to do that in Nashville. We're going to get through this. We're going to get to the other side. We're not going to be able to expand services. It's going to be hard to keep everything in place, but that's what we're going to do in Nashville. And every month that we are slow or late in reopening will make it harder financially to do it. But we will have a great city on the other side, and we have to be prepared to serve all of our citizens right now and getting into it. Thank you.
Nancy Ammons, you're on the air. Nancy?
Hi, thank you. I have 3 questions for 3 people. Would you like to take them one at a time?
Sure.
Okay. One question for Dr. Caldwell. We spoke of last week, I think, about the number of people at the fairgrounds who had been tested, and I think at the time had said that there were 3 people waiting for those tests back. What have we heard about the people who were tested at the fairgrounds?
Dr. Caldwell?
Yes, there are 2 positive patients at the fairgrounds right now. Thank you.
Nancy?
My next question is I would like to hear Dr. Johaniger's thoughts on the heat map. We're seeing quite a bloom there in Antioch area. What are his thoughts on that?
Dr. Jungir?
Thank you, Nancy, and you're right. There is more red in the southeast corridor, and that has to do with a 4th cluster. So the first map that you saw, there were 3 clusters that had occurred in March that were represented on that. This 4th cluster that happened is actually a group of individuals that work together at a somewhere else outside of Nashville, but they all seem to live in the same neighborhoods. And I want to highlight, of the 4 clusters that we've reported or that are out there, that represents 7% of all cases. So only 91 people are impacted by any of those 4 clusters. So it happens that this 4th cluster impacts, I believe, 25 individuals, and that is, as you appropriately pointed out, those individuals seem to live in the southeast portion of our city. So thank you.
And your third question, Nancy?
Thank you. My third question is for the mayor, and thanks for taking these one at a time. Mayor just said a minute ago that he wanted to wait to see that the cases are flattening before reopening. Yesterday, we heard in the state's address that they're encouraged that the cases are only going up by single digits. Is he concerned about the state reopening when the cases are still going up?
Mayor Cooper?
Yes, Nancy, and in fact, I've spent some time on that this morning. Questions. What is the case profile? What is the case load? It's something that everybody in Nashville will probably have a separate opinion about, but we want to be guided by epidemiologists and experts as to what does that number look like. We know the curve, the sharpness of the ascent is flattening. And that's a great thing, but it doesn't mean that we're not increasing in cases. And what are the right metrics that epidemiologists would feel that we can begin to relax some of our restrictions? Right now, I don't know that anybody in the country or in a state or in a city has exactly the answer to that. We do know, and this is something for your viewers to be aware of, is that the better you are at social distancing, then the quicker you can begin to relax some of those restrictions. And the disease also is not going away. Until there's a vaccine that's going to be in our community for an extended period of time, meaning that we're going to have an extended level of protocols, not necessarily business closures, but for sure a level of protocols that people are going to have to be following for months ahead at a time. So getting used to those protocols is going to be very productive for everybody to be able to do that. So what the number is that allows for a restart, again, everybody's assessing. I'm going to depend on HCA and Vanderbilt to have very good answers to that specific question as well. And we don't really have the chance to relax too much. We still have a large increase in cases. We still have people in the hospital. We still have 3 additional deaths that we had to report today. So this is a long way from being over. But there are going to be strategies that are going to help us ease back into a more normal condition. Thanks.
We have 2 more questions, Samantha Max and Kara Hartnett. Let's start with Samantha Max.
Hi, my question is for Representative Kennedy and Director Lance. I was hoping to know if they could talk about any data trends that they've noticed so far in terms of mental health and domestic violence. Have there been any upticks in reported suicides or domestic violence or child abuse calls? I know that there had been a little bit of disparity in the police saying that domestic violence calls seem to be kind of at a flat rate, but that the YWCA was saying that they were seeing a spike. If you could speak to that and any trends you've noticed.
Representative Kennedy, would you care to comment?
Yes, the suicide hotlines are up over 800%. Anybody who's watching this closely knows that the overdose rate continues to rise. We're not going to pay much attention to it because all the focus is on COVID. But the whole point of today's, release is that we ought to be concerned about people dying, whether they're dying of the COVID flu or whether they're dying of overdose. It's still a death, and there's not one that's worse than the other because they both deaths rob families of a loved one, and they ought to be paid attention to. And I salute the mayor and all of those there for paying attention to this. We've seen the McKinsey report shows an enormous rise, not surprisingly, of anxiety, depression amongst the whole total population. So we get you those statistics, and I'll make sure that you get those for your reporting.
Thank you, sir. Diane?
Thank you for the great question, Samantha. Well, in terms of the YWCA hotline, both hotlines are seeing an increase in about 30% in their calls, which makes sense. That is an outreach you can do for help that you don't invite someone else into your home, such as a police officer, and you don't have to leave your home. So as far as the flattening of any other numbers regarding reporting to police or going into shelter, getting an order of protection, those numbers are remaining the same. I think it's really important to point out, though, that one of the most effective tools that domestic violence abusers use to prevent their victim from reporting is isolation. Domestic violence is one of the most underreported crimes across the country at a 47% estimated underreport rate, and that is because abusers isolate their victim. And so here we have a situation where not only is the abuser isolating the victim, that is a mechanism, that's the way you stay safe right now and healthy, is to be isolated. And so that makes it all the more complex and will drive those reporting numbers down, which is why we are again stressing there are ways to get help by texting, there are ways to learn how to leave safely, and that the shelters will help, will find a place for you to go where you and your children can be safe.
And our final question is from Kara Hartnett. Kara?
Thanks for taking my question. We talked about this briefly last week, but with the 3 more deaths reported today, having been men, which I believe still makes all the deaths in the county for male patients, is that a data fluke, or is it too early to draw conclusions from this? Or is this something actually meaningful that you're looking at about how COVID is affecting patients in our region?
Dr. Jungir?
Sure. So thank you for the question. There's 16 deaths now, which from a pure academic standpoint is too small to make statistical significance. But you're right, they're all men. And I think one has to recognize that all these men have underlying health conditions. There's some reports that this virus may impact men more than women as far as lethality. Again, a series of 16 doesn't make for an academic study. But it's not a data fluke. The data is what you see. And so, yeah, so I think you're right. But I think, and if you look at the breakdown of race and ethnicity, 9 are white, 6 African American, and 1 of Hispanic ethnicity. And again, those are all things we follow, but this virus impacts those who are most vulnerably medically, and all these individuals have had underlying medical conditions as well. So the data is what it is, but I just highlight this, only 16 people, which is not enough to make long-term statistical information. Thank you.
There are no more media questions at this time. A special thanks again to former.
All right, everyone, you are listening to the Daily Metro Coronavirus Task Force briefing right there. We're listening in, too, taking some notes here. I took a bunch of notes on some things that came out of this toward the end in the question and answer period that were very important. You heard Mayor Cooper talking about the future for our city and what that will continue to look like down the road, and how this will be a long way from being over. Once they reopen the economy, we're still going to continue to have to experience social distancing. In some cases, he was talking about businesses putting up plexiglass barriers and being able to track individuals who are infected for a long period of time. So as we start thinking about the future a little bit, we start talking about reopening the economy, the mayor, the governor, and leaders all over the country are talking about how this will be an imposition in our daily lives for months and months to come.
Yeah, this is not a short-lived thing. Part of that, too, I thought was interesting that the mayor brought out was also taking your temperature every single day, and that this could soon be a requirement for all of us on a daily basis to help us find the cases, all working together to continually flatten the curve and contain the virus. Interesting statistic, too, that we just heard, and that was from Representative Patrick Kennedy, talking about the calls to suicide hotlines up 800%. Just some startling numbers. And then locally, an increase in calls at some of the shelters here, the hotline calls up 30%. But that just really opens up so people can understand what so many of even our viewers are dealing with. And sometimes being at home is not the safest place to be, and they're being told to stay at home right now. So what they're talking about, the message is there's so much help that is available for everyone right now.
Yeah, in so many different ways, too. They're talking about the Ywca and these numbers that you can call or text. So abusers, oftentimes, you heard there from Diane Lane saying that abusers will try to keep their victims isolated. So she's saying there are so many ways you can reach out and get help right now, whether it's through texting and phone calls. I took down a phone number here. I've got so many notes here, it's difficult to find that. We're working on this story right now. In fact, one of our colleagues just put a message out that they're working on the domestic violence help and the suicide number. So we're going to get some more information on that. You'll have that story later today on News 4.
Absolutely. I'm going to list that number real quickly. The Ywca hotline number, 800-334-4628. Again, 1-800-334-4628. And you can text, for some people, that's the better way. You can text 615-983-5170. We know this is a very sensitive situation for many people in their homes, so that's a heads up. We'll, of course, have more of this online as well. And quickly wanted to mention, sadly, we do have 3 new deaths that came out of this in the last 24 hours. So we know Davidson County now up to 16 deaths in Davidson alone. Sad to hear that. Of course, we'll continue to follow this. We'll have much more perspective for you and much more coming up on News 4 at noon. Thanks so much for watching.
Book, and you ask, it's just full of questions, and you ask each other questions, and it gives you some insight. You talk about this 5 to 1